surgical help.
I had that baker's cyst down behind my knee. The amount of pressure now from, like, literally my knee downward, it's just so painful. I can't straighten my leg now.
So you OK having your bloods done?
I think so.
Do you tend to faint?
I won't look, put it that way.
You won't, no, but do you tend to faint?
His tears are bloody and there's a bit of blood in the corner of his eye.
OK.
Just pull down your trousers, lie curled up in a little ball on your left side with your knees up to your chest, facing the wall. Are you ready?
Oh, I wouldn't say no to a cup of tea. That would be amazing. Georgina, I have a fund. People put in £5. People just help themselves to squash, sugar, biscuits, chocolate biscuits. There's hot chocolate in there. There's biscuits, mints upstairs. So if you want to join the fund, let me know. Oh, and Heather does obviously the milk fund as well. I don't know how much she charges though. I'm not in the milk fund.
Janet Shaw, please.
Yes.
Hi there.
Hello. I think I've seen you with Janet before. I'm her sister and carer.
I didn't see her there.
Of course, her little legs don't keep up with me.
Well then, come on in.
Come on in, Janet.
Hello, yes.
Hi there.
Well, unfortunately, Doctor, Janet has had skin cancer this summer.
Right.
And had an operation.
Right.
But I'm not happy about what's happening here at the moment.
And what has been happening?
Well,
Tell me a little bit more.
I looked today and it was weeping.
Right.
And I don't quite know whether to cover it up or let it just go.
And has it grown at all, or has it just been weeping?
Very quickly.
Has it? So it's grown quite a lot?
A fortnight ago, we went to see the dermatologist on a Saturday.
Oh, right.
She got to have another operation.
I see. So the operation is coming. Did they say what kind of skin problem it was?
I think it's carcinoma.
Basal cell carcinoma is one of them?
That's it.
Is that the one? OK. Have you been in touch with the dermatologists?
No.
We need to get the message back to them, don't we? So that they can then see what they want to do. Can I have a little look?
Yes.
But the other one, it was just warty, like a wart. But this one is like more ulcer.
Yeah. Because I think it does look like a BCC, and they can sometimes get an ulcer in the middle. It doesn't look like it's infected to me, so I'm not worried that there's something else going on, and I will write to them telling them that what size it's got to with the ulceration and the weeping, and otherwise I'll just cover it over. I will see what they can do.
OK,
and ask them to give you a ring. All right.
Bye.
No problem. Nice to see you.
Bye.
You go well.
Bye.
Jolly good. Bye then.
Bye.
Lene, please.
Come on, love.
Come in. You're all colour coordinated with your dress and your shoes. Thank you for waiting.
That's all right.
Right, which one are we seeing? This one?
Yeah.
You? Do you want to play with the trains? Do you want to play with these? Can I have a play?
You watch
Play that one. Right, what's been happening then?
Well, she's been complaining that she doesn't feel very well. But then last night she wet the bed, which is very unusual for her, and she's been going to the toilet like every half an hour to 45 minutes, and she's done 4 poos as well today.
Oh, right, OK.
So, yeah, it's quite unusual for her.
Any diarrhoea at all?
No, no diarrhoea. And she, I don't know if she understands, but I've asked if it burns or anything when she wheezes, and she says no.
Right, OK.
But it's just more, she keeps saying that she doesn't feel very well.
Right, OK.
I bought you a sample just in case.
Brilliant. Do you think she's had a fever at all?
No, she's been normal, like normal behaviour.
Let's dip this then. Has she had a urine infection ever before?
No.
Hello? No. I'm going to dip this in here. See what it says. Let's just give that another minute.
Okay.
Can we pop you on the bed so I can feel your tummy? Oi, God, you're heavy. Right. Are you ticklish? Yeah. There? There? Right, let's have a feel of your tummy. Does this hurt anywhere? No? That's okay, that doesn't hurt. Fabulous. Okay. Right, do you want to get down again?
Ready? Jump.
Oi.
Good girl. Sorry. Come on then.
See what this is saying. Oh, yes. It has developed. Yes, she's got a urine infection.
Okay.
Okay. Now, what we'll do is, with children, we send their urine off anyway, just in case it doesn't respond to the first lot of antibiotics that we give them, then we know what to give them next. So
Yeah.
I'll send that off. But if she's getting worse at all, you think she's developing a fever, she starts saying she's got tummy ache or anything like that, ring 111 straight away so that they can see her out of hours.
Okay.
And then just loads of water.
Yeah. That's fine.
All right?
Thank you.
And I'll bring this out to you. If you have a seat in the waiting room, and I just need to sort this prescription out, and I need to get the duty doctor to sign it.
All right. Thank you very much. Say thank you.
Bye-bye. See ya. Right, how can I help?
So from Saturday night, I had like really intense chronic stomach pain, and then intense pain again Sunday all the way through the night. So it's basically every evening or earlier, it's just like chronic pain. Sometimes it's like a burning sensation here.
And during the day, it seems okay, or it's gone,
just really
or
sore.
easier?
Yeah, it's just really tender at the moment.
So it's mainly the pain that's bothering you, and you're off your food, you don't feel like eating. Any vomiting?
Yeah, twice last night.
You don't smoke, generally fit and well.
Yeah.
When was the last time that you took any paracetamol?
I tried to take some last night, but I was sick afterwards, so that didn't really happen. And then I got given cocodamol last night, and I was going to take one before sleeping, but then I was actually like quite sick, so didn't take any.
Open wide for me. Big amounts of vomit?
It was just like the little amount of food I ate.
Have you had anything to eat today?
Half a slice of toast.
And that's it. And you haven't really been eating well since Saturday?
Yeah, so about a slice of toast a day, maybe some natural yoghurt.
If you come and have a lie down here, so you haven't travelled anywhere in the last month. Did you go somewhere before that? It sounded like you may have done.
I was travelling Asia for 7 months.
But were you well after that?
Yeah, really well.
So did you get any tummy bugs or anything while you were out there? Because it's sort of standard.
Yeah, so I got a few there and, like, obviously know how bad that gets, so I wouldn't be going to A&E unless it was chronic.
The pain's worse at night, but it is there pretty much all day?
It's tender now, so, like, if I was in the pain I am at night, I would definitely be like, oh, that's a bit tender there.
OK, that's quite sore for you, isn't that? I'm sorry.
No, it's fine. I'm just worried of what it is.
Hello, it's Culprit Reception.
Hello. Just wash it. That's fine.
Hi, it's Dr. Ramshaw from Horfield Health Centre.
Hello.
No problem.
The dog really needs a haircut.
They don't do buy one, get one free.
I'll sort that out for you.
Tell me what tablets they were.
Hopefully that should clear it up.
Bye-bye.
See you then.
Bye.
Cheers, bye.
OK, all right, in you come. All righty. I haven't seen you for ages.
I know, it's not good.
Well.
This is about my knee.
OK.
You know, I don't know if you knew, I had that Baker's cyst in the back, and the thing that they wanted to go forward with was injections into the kneecap, and I just really didn't want that because, well, I know a few people who'd had it done, it didn't necessarily work, and from what I'd read up about the cyst, it might strengthen my knee, but it wouldn't necessarily do anything for that.
OK.
And this is filled into such... Because I've been sat with my leg bent. I pull my wheelchair forward like this because I'm so weak down one side. I can't use both hands really to wheelchair.
Dragging it with your leg.
And I've been doing it for years. It's just filled up so much I can't straighten my leg now.
Right.
Down behind my knee.
What would you like me to do today then? I will have another look at it.
I'd like to know if we can drain it because the amount of pressure now from like literally my knee downwards and what it's doing on this foot, it's just so painful.
Maybe we'll do this with you on the bed, Alison, actually. Is that all right? Might be easier.
It's just so painful to actually straighten my leg. It's...
Yeah, OK. So if you can hop over and lie on the bed probably on your front, actually.
OK.
Have a look at that.
Yeah.
A Baker's cyst is a fluid-filled swelling that develops at the back of the knee. Sometimes it's caused by trauma or by osteoarthritis or some other form of joint problem.
I went to Liverpool last week.
OK.
And it was...
You've had a top-up on your accent.
It's... I have, actually. That's funny you say that. But I got, like, one day in and it, literally I couldn't even pull myself round anymore.
OK. Swing yourself around. So, I still think it's a Baker's cyst, OK? What do we do about it? I'm not just going to stick a needle in the back of the knee myself because there are other structures in the back of the knee and, you know, you could do harm. OK, I'll ask for an ultrasound scan of the back of the knee just to confirm it's a Baker's cyst and there's nothing else going on, all right? Simultaneously, I'll also refer you to the musculoskeletal assessment service for them to advise on what's the best way forward, which I suspect will involve the help of an orthopaedic surgeon. Actually.
OK.
Yeah.
Thank you.
Is that all right? Is that a plan then?
That sounds
OK,
brilliant.
so I'm just going to write in my book to get those two things done.
I was worried you were going to say, well, actually, steroid injections under the kneecap is the only way forward.
No, I think it's a bit too big for that, actually, to be honest. Yeah. When you go for your ultrasound, you'll get an appointment through the post for that. OK, I'll do those referrals.
Thank you.
Yeah, lovely to see you.
Thank you.
OK, go for yourself.
Bless. Have a good day.
Cheers.
Let's just have a check of that. So there's no sugar in your urine. There's lots of ketones. I'll explain what that means in a second. No signs of infection on this sample. So ketones in the urine means that you're getting a bit dry, a bit dehydrated, and you look a bit dry, a bit pale. So I think we've come to a stage where you would benefit from having some fluids through a drip and some blood tests just to see what's going on, maybe an ultrasound scan. It's not fitting into an appendix kind of picture, but it could be pyelonephritis, which is that you get a kidney infection, but the urine's not always showing anything up. But I think we've got to a point that we need a bit more help with it. You haven't got a temperature or anything like that. Your blood pressure is a bit low. And that's also why I'm a bit worried about you being a bit dry.
Yeah.
Is there anyone who can take you up to the hospital?
Yeah, my stepmum's coming at
All
half
right.
an hour.
You look very upset.
Yeah, I'm just worried.
What are you worried about?
Just that I don't know what's going on.
Yeah, OK. But you're dry, and we need to just pep you up, do some blood tests and see what's going on.
Yeah.
You don't have to wait in the main area. I can give you the side room to wait and make a call.
Yeah.
And I'm going to speak to them at the hospital about this.
Thanks. Cheers.
All right?
Yeah, that's great.
You know there's a water fountain, so it'd be good to drink some water.
Yeah, I'm going to drink some more.
So if I show you where that is, because
Yeah,
I'm just going to make a call. Don't forget your things. All right?
Thank you so much. You've been
That's
really
okay.
helpful.
Just got a lady in here, OK?
Oh, yeah, cool.
Just in there.
Thank you.
That's OK.
Not very good with needles.
Not many people are.
If you want to have a look, that's fine, but just in case it makes you feel a bit funny.
Do you not like looking?
No. I've got good veins.
Yeah.
My best friend's a midwife and she loves my veins.
I find it satisfying watching this.
Flowing well today.
I'm sweating.
Oh, you just keep on taking the blood.
Got me sweating as well.
Shan stock. All right, if you just want to come take a seat.
Hi.
How are you feeling? You all right?
I think so. I think so.
Good. Just going to do a quick blood test. Are you okay having your bloods done?
I think so.
Do you tend to faint?
I won't look, put it that way.
You won't. No, but do you tend to faint? Do you think you'd be all right, or would you prefer to lie down?
No, I'll be all right.
Yeah?
I just won't look.
All right. Not many people do.
Is that so? All right, so I'm not abnormal then?
No, I don't look when I have a blood test taken, and I do it for a living.
Okay. So this blood test is going to test all sorts of things, is it?
This is going to test your HbA1c, which is your sugars, full blood count, which will check your red blood cells and white blood cells, haemoglobin, electrolytes, which is your kidneys, your liver function test, which is your liver, lipids, which is cholesterol, and your thyroid.
Right, OK.
So giving you a bit of a...
They're all over the same.
Check-up, yeah.
Right.
Are you OK with plasters?
Yeah. No problem with that.
All right. Okay, I'm just going to wash my hands.
So this is all part of this sort of health check, then?
Yeah.
Yeah.
So this is the reason why we're doing it, is just because it was advised that you needed the blood doing. All right.
Right.
Your BP was done
yesterday.
Last time. Yeah. Oh, it was yesterday, was it? And that was okay.
Yeah.
So that's good. So now we just need to wait for the results of the bloods.
Yeah. So yeah.
All right.
So...
Which time do we go for when taking bloods?
Oh, let's go for that one, because I can look this way, can't I?
All right. All right. Do you want me to tell you what I'm about to do? No, just go ahead and do it.
Just go ahead and do it. Yeah.
All right. Oh, bless you.
Yeah, I used to give blood very occasionally.
Yeah.
And the last time I gave it, I keeled over completely. And they said, "Oh, please don't come back again." And I said,
really?
"Well, don't write to me then. Keep asking me."
Yeah.
So they haven't since. How much you taking?
Just two small bottles, all right?
2 small bottles? Gee.
Well, no, not bottles, but like 2 blood vials.
Right, OK. I imagine it's a massive thing now. Is it all done?
No. All right.
All done?
All done.
Oh, fantastic. That was amazing.
Oh, thanks.
Yeah, no, brilliant. I've been gearing myself up for this.
Oh, bless you.
It's ridiculous, isn't it? It really is.
No, it's not. If you bear with me a second, I can pop a plaster on.
Right.
All right. Don't want you walking out of here and leaving a little trail of blood behind. Scare off the rest of my patients, you will.
So the results, will they tell me?
The results will be back in 3 days.
Right, OK.
And we can give you the results over the phone.
Right, OK. No, that's brilliant, yeah.
Let's pop a plaster on for you.
Gee, that was a lot. I got to eat and drink loads tonight, haven't I, to make up for that.
Such a big amount. All right.
Probably stopped, is it?
Yeah, perfect.
Right.
Souvenir to remember me by.
Excellent.
All right.
Thank you so much. Nope, that's brilliant.
No worries.
Have a good afternoon.
And you, take care. Bye.
Thanks. Come along in and have a seat. You okay there?
Yeah.
Right. How can I help?
My tongue is hurt.
Okay, your tongue is hurting.
Yeah.
Okay.
My throat.
Okay.
It's burning.
Okay, your mouth and throat are burning. Okay, yep.
And it like sandpaper.
Okay, fine. How many days? How long has that been feeling bad?
For a while.
For a while. Okay, okay. And are you feeling well in yourself otherwise?
I'm low emotionally.
Just say that again.
I will write it.
Okay, okay. I didn't quite catch that bit, so that would be helpful. Okay, so you're a bit low in yourself. Yes. Okay. Shall I have a look at your throat in the first instance? Actually, I'm going to start off by just checking your temperature. So, can I put this in your ear to check your temperature? Okay, that's great. That's fine. That's not that. No fever. Okay. And now let's have a look in your throat. That's great. And just say ah.
Ah.
And again.
Ah.
Fantastic. Okay. I can't see anything, any muck in the throat. Let me have a little feel. Can I just feel your neck?
Yeah. This is about there.
That feels sore there. Okay. Are you able to eat? Okay. I think, as I say, the throat looks okay. I can't see anything particular in your mouth, but I think if it's feeling sore and it's feeling like sandpaper, something that might be causing you problems is thrush. That can make your mouth feel very uncomfortable. It's a very simple treatment.
Yeah.
And then if that doesn't help, you can come back and see us. I'd give you a week's course and see if that would help. Okay. The other thing you said was feeling quite low emotionally.
Yeah.
Do you think that's tied up with your mouth getting you down, or is that a different thing?
Different.
Different thing?
Yeah.
Okay.
Different thing that I'm a human being.
I think I'm going to need to get you to write that bit. I didn't quite understand. Oh. That's how you feel, that some people are disregarding you as a human being?
I'm a human being with a disability.
Yes.
Well, the disability is not the hard thing.
Okay.
Take a seat then, OK?
Are you ready then?
It's a digger, isn't it? I'm not digging that at all. No, I can't both read that. What about this one? He's riding a kangaroo.
Hugo, please.
Come on.
Hiya.
Hello, how are you? Hey, how are you doing?
Yeah, good, thanks.
Good.
Hiya, so what's been happening to you then?
Hugo fell down some stairs this morning. He was coming down the stairs behind me, and I turned around to like pick some wet wipes off the stairs, and he just like came down in front of me, and so I caught him on the rebound. I don't think he was that far behind me, so I think he maybe fell down a few steps straight down onto his head. And cried a bit.
Sure.
And then stopped crying, and I thought, this is cool. But then I noticed there's a bit of, like, his tears are bloody, and there's a bit of blood in the corner of his eye.
Okay.
So they're like carpet-covered wooden stairs, and he cried for...
And he landed on the stairs rather than on a stone or anything harder?
On the stairs, yeah. On the stairs, yeah.
But he hasn't been sick or had obvious problems with his vision or...
No, he's been really perfect.
Using his arms and legs all normally?
Yeah, everything
Eating
fine.
and drinking fine?
It's normal.
Just got this bit of blood since
Yeah.
then. Hello.
I mean, he might have stopped now, but he was
Can
there
I
for a
prod you?
while.
Can I tickle you? Right, let's have a little look. Look over here. Good boy. Look over here. So his eye itself seems absolutely fine, doesn't it? Just a bit of bruising just underneath.
Yeah.
There is just a little bit of bruising just under the eye, and I think you're right. I think he's just got a little bit of tiny burst blood vessel there. In fact, right in the corner of his eye, I can see.
Yeah, that's where the blood was coming from.
But the eye itself looks completely fine.
Yeah.
And he's moving it around completely normally, and he's following, and he's obviously interested in, obeying my instructions and doing everything he should be. So that all looks fine. Let's just shine a light in it. Good boy. Can you smile for me? Give me a lovely smile. Can you give me a smile? You've already shown me that you can do a nice smile, so I'm not too worried that there's anything else going on there. I think my sense is that he's just got a minor head injury from this fall and that this is nothing that we need to be worried about. I think he's going to get a little bit of a black eye and, you know, that's OK. What we don't want to see is him vomiting, him having obvious visual problems, getting drowsy. Those are all the sorts of things we get worried about with head injuries. Obviously, if he had a fit or started getting drowsy or you were worried, then bring him straight back and we'll do something more. Then we'd need to get the hospital involved. Yeah. But, you know, head injuries are really common in children, and as long as they're minor and we're not worried that he's done himself any major mischief, which is the case now, then actually we can just keep a really close eye on him and he'll just get on with life as normal, I'm sure. Yeah. Thank you. Does that answer all your questions? Yeah. Super job. And obviously just some Calpol.
I really wasn't worried. I mean, if I thought anything was really bad, I would have gone to A&E, I suppose. But
super job. Nice to see you then.
Thank you.
Bye. You going to give me a wave? No.
Say bye-bye. Say thank you.
Bye.
Good boy. See ya.
Bye-bye.
OK, so you have a disability, but that's not the whole thing.
Yeah.
Yes, OK.
And...
So you feel everything is put down to disability?
Yes.
And that's not how it feels? Yeah, that's...
And I'm supposed to be having some counselling.
Some counselling, OK.
But nothing seems to be happening.
OK, this is going back a little bit, but there was a plan for you to have a scan of your head.
Yeah.
Has that happened?
Yes.
OK, and do we know the result of that?
I don't really understand it.
OK, let me just have a quick look. Let me have a look at the last letter. Well, here we go, right. They found something very, very tiny that they want us to monitor. It's that the presence of this little something in the pituitary gland in the head, they suggest that it's not a good idea to prescribe you medication that they had considered because it's there, and that you're to have annual, yearly blood tests to look at the prolactin, which was that hormone that was found to be a little bit high. The main role it has really is in breast milk production, but it is also important in terms of regulating the periods as well. But I think though yours was a little bit high, they've sort of found that there's just a little tiny area within the pituitary that's producing that little bit too much of it. Yeah. OK, I think what I'm going to do now, because I'm slightly running out of time today, is to leave a message with Dr. Clark to just ask her whether or not we need to do any looking into your counselling.
Yeah.
OK? OK, so that's a prescription for your mouth.
Yeah.
And let's see if we can get that feeling a bit better for you.
Right.
All right.
Yeah.
There we go. Yep. All right, then.
Thank you.
OK, nice to meet you.
Nice to meet you.
OK, take care.
Bye.
Bye-bye.
Oh, it's you. Yeah, you. Good. Just finished?
Well, yeah, in a second.
Oh.
I got a card today. I'm really chuffed with it. Oh, it meant so much to me. I'm patient, but it's really, really nice. I cried.
Oh, what? So thank you. Oh.
Yes, I'm chuffed.
Look at you.
So when she gave it to me, I was like, there's just tears. So we just come in.
Oh, you soppy thing.
Oh.
So nice. Have a seat.
Oh.
How can I help?
My bladder.
Your bladder, yes.
I'm now peeing, since I don't sleep.
Yeah.
It's hard to say, but every hour.
Yeah.
Day and night.
Right.
And sometimes even more than that.
Why do you think you've got a problem with peeing?
I have no idea.
So often?
I pass a huge amount as well. It's not like a tiny bit. It's like, you know, pint.
Really?
Yeah. And I just don't know where it's coming from.
Do you drink quite a bit?
I drink a lot of
Fluid-wise?
tea.
Yeah. How
when
much?
I'm working in the night. Maybe 2 cups of tea in an hour, say, perhaps.
So do you drink 2 cups of tea every hour overnight?
Yeah.
So that might be that you're drinking 10 to 12 cups in 24 hours of tea.
Yeah,
at
definitely,
least.
definitely.
Yeah.
Yeah.
What about coffee? How many coffees in 24 hours?
Maybe 3.
Any other fluids apart from tea and coffee, or is that your main
Water.
fluid intake? And do you, well, how many cups of water would you have in 24 hours as well?
4.
OK. So when you add all that up,
Yeah.
And if you were to do a sort of fluid balance thing, and you were to look at how much fluid you're taking in and how much you're peeing out, it may not be that different, but the difference is that at the moment you're awake all night, which you aren't normally, or you aren't always, shall we say. The problem with tea and coffee is they've got caffeine in them, and that makes you pee more.
Does it? Right.
Definitely does, yes. OK? So that one of the things that you might find helpful, whilst we try and work out what the matter is to get some decaffeinated tea.
Yeah, I could probably drink... Leslie drinks decaffeinated tea.
Does she? Yeah. OK, well, why don't you switch to that in the first instance, see if that makes any difference.
That'd probably be all right, because it tastes...
OK. How long do you think things have been worse for with your urinary frequency and urgency?
6 months.
Are you worried that there's something a bit more significant going on?
Not because you told me that, you know, you've examined my prostate
Is that
relatively recently. Well, I came in and you told me you'd done it the year before, I think, last summer.
Here it is. It was June 2015. But I guess we could do it again because it's changed so much in the last 6 months. Do you see what I mean? Do you want me to do that now?
OK. No, it's fine.
Get it done?
Yeah.
Yeah, just to see whether your prostate has got bigger. So I think, but we ruled out diabetes. So I think I should examine you, you should have a blood test done, and then we should discuss the result and work out what we're going to do next. But I think if you reduce your decaf, you might be a lot better.
Lifestyle change.
Yeah, you're good at that, sometimes.
What does it mean?
Reducing the amount of caffeine. Just pull down your trousers, lie curled up in a little ball on your left side with your knees up to your chest, facing the wall, OK?
There's a big fuss made about this test.
There is.
Which I think is silly.
About which test?
This test.
Oh, having...
There's nothing horrible about it. It's perfectly
not too
fine.
bad, is it? No. You ready?
The next one, yeah.
It's the next one.
Yeah. Put in a camera or whatever.
Yeah, that's absolutely normal. You have not got a big prostate.
Good.
OK? Now, don't fall off as you get dressed, because it's a really unusually narrow bed, OK? OK, so unfortunately, we haven't got anyone who can do bloods today.
OK.
But I don't think it's urgent. I think just have the blood test done in the next couple of weeks, OK? That's for you to have a read. Is that all right?
Yes.
Today? Yep. Great.
Cheers.
Very good. Bye.
All right, how are you doing? We're right down the end of the corridor. A bit of a long walk, nice bit of exercise. Come on in, take a seat.
Okay.
Right. You okay there?
Yeah, fine, thanks.
All right. So, I was just looking at your notes from last time, because you saw Kaylee, didn't you, last week?
Yes, I did, yeah.
And you weren't feeling too good, were you?
No, I don't know what it is. I think I've got conjunctivitis as well. Some stupid thing going around in my head.
Your eyes look okay. Do you want to take your glasses off? Let me just have a look.
Yeah, sure.
Are they very weepy? Are they sort of crusty?
Just a film across them.
Right. When you wake up in the morning, is no crustiness or?
No, that's not there.
They look absolutely
They look
fine
all
at
right.
the moment. Yeah.
It's got to be my glasses gone wrong. I need a new pair,
Yeah.
definitely.
Would you like me to give them a little bit of a clean?
Please, they've been through the wars with me.
Yeah.
So I don't want to get rid of them.
So are you
but
feeling a bit better now?
Oh, yeah, from that, yeah, I am. I blamed whatever I had on my eyes as well, but I blame everything on that.
Try that.
Yeah, thank you. That's because these are designer. I paid a mint for them. Oh, that's see everyone now.
Is that better? Is the filminess gone?
Yeah, there. I'm a few I'm talking to you now.
Okay.
Oh,
so let's have a look at your leg. Is it?
Yeah, here are. I've got my new stockings have come through. Sorry I didn't bring them in today.
That's all right.
I did change it the other day.
Okay. Just pop your foot on the tissues for me.
It's on a leak.
Yeah. Because, usually we put a big pad on, don't we?
Yeah.
So you changed that, did you?
Yeah, it leaked the week before. It leaked everywhere. I thought it should be under the foot as well, that dressing that you Just taking off that long yellow line.
Yeah.
It's not very nice, is it?
It looks like it's half off this one anyway.
I think that's going to need a bit of dressing help.
So it's not oozing any liquid, is it?
Our nurses are the experts as to what's the best dressing, so we'll go with their advice.
All done.
Lift your foot up, just so until you hit that. Have you still got your lodger with you, or?
I do, yeah.
Yeah.
I do.
Does that work out? Or...
He's gone away. He's gone. he's a kind of carer, so he's only sort of part-time with me.
Oh, yeah.
Yeah, he's gone away.
Oh. Does that feel okay?
Yeah, very, very nice. Thank you. That's it.
Yeah?
Yeah, that's fine. That's lovely.
You sure?
Yeah,
You in?
that's lovely. Yes, thank
Don't
you.
be tripping up. Well, it's nice to see you, Linda, and...
Yeah, thank you very much, Sue.
No worries. You come up with me now.
OK, thank you.
We can...
OK, that's lovely. Thank you very much. Yeah, thanks very much.
Gonna be... Riley Warner? Oh, that's me. Sorry, I'm so late.
I'm late anyway. Have a seat.
I'm absolutely boiling.
Right, what can I do for you?
Well, firstly, I wanted to get another prescription of the pill.
Right, OK.
But then I also have been looking at getting the coil. Because
OK.
I'm not very good at taking it regularly.
It's a good reason to consider something else.
Yeah, because I did have the implant and I didn't really like that.
Yep, no, it's a really good option. So have you looked into the two kinds of coils?
No, I haven't.
Right, OK.
Right,
so there's two kinds, two main types, OK? One that has a hormone and one that doesn't, that we call the copper one. So the simple one is the copper one that works as a contraception, as a device in the uterus, OK? And it releases copper that stops you getting pregnant and stops implantation. So it's very effective.
Yeah.
The downside of the copper one is, or it could be, not with everyone, it can make the periods a bit heavier. So the hormone one, OK, we fit it the same way, but it releases a small dose of progesterone. OK.
Yeah.
So we suggest giving up to 6 months to let it settle down. So when I say settle down, I mean you might get irregular bleeding.
OK, so it might be a bit kind of
all over the place, but then it often does settle, and in many people you get either very light, occasional bleeding or nothing at all.
OK, yeah.
So the other thing to chat about is how we insert it. So have you ever had a smear test done?
Yes.
Yeah, so it's a little bit like that, OK?
In the same kind of procedure.
Yeah, exactly. So the doctor does it with the assistance of a nurse, OK? So it takes about 10-15 minutes. So when we put the coil in, or when we use the other instruments, there is an increased risk of perforating the womb.
OK.
So that's a risk of about 1 in 1,000.
OK.
There's a risk of infection. There's a risk of it coming out. OK? If you had a very heavy period or something like that.
Just check it.
Yeah.
OK.
Yeah. So the other difference is the copper can be inserted for 10 years and the hormone one is for 5 years.
Wow, OK.
Yes.
That's quite long.
OK. So shall I give you some information about them?
Yeah, that would be great. That would be really great, please. Yeah, I don't think there's any other questions. I'll read this and probably
so
have loads of questions
well,
afterwards.
that's fine. Just give us a ring and
OK.
we do telephone consultations so I could chat to you.
Oh, OK. Well, that's brilliant, yeah. Thank you.
So in terms of your pill at the moment, so should we just give you some for now to be going on with?
Yeah, maybe give me another month or something.
Yeah,
just,
OK.
So I've got... Just in case.
Yeah, no problem. You can have it fitted any time of the month, really, as long as you're definitely not pregnant.
OK. Ah, that's good to know. Yes, thank you.
Yeah, no, it's a really good form of contraception. You can have it removed when you need to. Those leaflets are quite good, so have a little read.
Thank you very much.
OK, no problem. Well, good luck on your decision.
Thank you very much.
OK, no problem. Bye-bye.
Freddie, please.
OK.
Hi. Hello. Don't recognise you for a minute. I think you've changed your hair or
Yeah.
it back. Hello, Freddie. Sorry, it's not This is about you, isn't it? Let me grab another chair. OK. There we go. You seem to have grown.
Yeah, getting bigger.
Oh.
So, do you want to tell Doctor first, or do you want me to?
You.
So Freddie's just started having a stammer.
Right.
It's not all the time, and he's always sort of had it there, but lately it just seems to be getting worse.
And so how long ago do you think this started as a thing?
Quite long ago. But it's just getting, like, worse and worse.
Mm. There was a time when it didn't happen at all?
Yeah, you didn't always have a stutter, did you? Like a stammer.
No.
Are there times when it's more likely to happen?
It's mostly when I'm speaking to lots of people as well.
Mm. Does it happen at home?
Yeah.
Yeah. So mum, you hear it.
Yeah.
Yeah. Yes. Okay.
You know, it might be 3 or 4 times a day that he'll do it, but and then other days it'll be like constant, and he's really getting stuck, and he laughs at it.
Yes. Yes.
But I think at school he gets quite annoyed at himself sometimes, don't you? Although, you know, I think his friends are quite good about it.
Yes.
As well.
Yeah. Good friends.
Yeah.
Yeah. Good. Anything else that's upsetting you anywhere in your life?
No.
No. Okay. You're getting on all right in school. Do you work hard and do all right?
Sometimes.
Okay.
No, he's pretty good, I think.
Yeah.
You do get quite anxious sometimes, don't you?
Yeah.
If you are a bit anxious, it's more likely to happen.
Yeah.
So you're obviously, here with your mum, feeling
But
quite calm.
Freddie does suffer sometimes, and he did suffer with panic attacks.
Right.
Back in, was it about a year ago or so? And I know I spoke to Mind. Is it Mind?
I see.
And we did like a worry box.
Fine. Okay.
So all his worries we used to put in a box.
Yeah. I mean, it's interesting. It's obviously not there the whole time, and it wasn't there always. And that encourages me that actually this isn't going to be a thing that you're going to have
that's what I'm
lasting, ongoing
thinking.
problems with. The thing we do is to ask what we call a speech and language therapist to see you. So there are people who specialise in speech and language, so in the ability to communicate. And they do look at this as a problem. Do we need to do that yet or not? Maybe have a think about that. And if actually you get home and think, well, no, I do want something done about it, I will make that referral. But I also don't want to...
No, maybe we'll leave it for a bit longer then and just see.
Yeah?
See if it calms down.
Do you want me to give you a list of sort of resources you could look up?
Yeah.
Yeah? Patient.co.uk or NHS Choices.
Thank you, Doctor.
Okay, lovely. Very nice to see you.
Yeah, nice to see you. See you later.
Bye, Freddie.
Bye.
Bye.
Nice to see you.
It's been nice meeting you.
You too. Bye-bye.
Bye-bye.
See you later.
Alligator.
In a wild crocodile.
Thank you. That's the plan. Great. Cheers then. Bye.
Thank you so very much for seeing
That's all right. Nice to see you.
Hello, sweetheart. Bye-bye. Enjoy your... Yes, you're gorgeous, aren't you? Bye-bye.